The Uganda Protestant Medical Bureau, UPMB, is a national umbrella organization for Protestant, Adventist, and Pentecostal-founded member health facilities.
And their coming together was to form an organization that was initially established to be a channel of support to the health facilities that belong to these churches.
About 80% of the 291 health facilities are located in rural and remote areas and include 18 hospitals, 10 health training institutions, 10 health center 4s, and 263 lower-level health facilities. UPMB facilities constitute about 35% of the private non-profit health facilities across Uganda and are one of the 3 religious medical bureau networks in Uganda that own about 45 to 50% of the total hospitals and 65% of schools for training nurses and midwives. UPMB serves those mostly in rural and remote areas. Many of the people in these target areas are often unable to pay out of pocket for the services they need and often make difficult decisions about accessing healthcare that perpetuate ill health or result in poverty.
Most of the people in this community come from an agricultural background, and because of the seasonality of agriculture, a lot of times access to healthcare can be a problem.
People had difficulties paying the hospital fees, and so many patients would run away from the hospital before discharge. We used to see so many people coming in so late, very late in advanced stages of disease.
When someone falls ill, at that moment, they may not have resources to meet their medical needs. So what we've tried to do is to come up with innovative ways of how we can mobilize our communities to save resources so that they can then utilize those resources at the point when they are ill. And this we've done through what one may call community health insurance mechanisms.
Many parts of Uganda use a token-based system where the user contributes a fee towards the services.
The communities organized themselves into burial groups so that when your group loses someone, you go and bury, another group buries somewhere.
And the idea was to come alongside those Bataka groups. They were dealing with death insurance. Why not deal with health insurance? Bataka, Tweetambiri, natives, locals, we heal ourselves. So the idea, a small amount of money, 15,000 shillings per year with a small copay, Rukumibiri, 2,000 shillings.
Then we started introducing the idea of community-based health insurance, and the members initially they were skeptical because it was their first time to hear about insurance. Like, what if I don't fall sick? Where will my money go? Will it be refunded? So we had to go through a series of community engagement to bring all members on board.
UPMB's solution is the Community Health Insurance, CHI, through which the communities contribute an annual premium fee, subscription usually at flat rate, towards their medical treatment to a specified facility.
Community health insurance is basically to ensure that we provide access to quality and affordable health care in this community.
It started way back in 1996, and the purpose of starting this scheme was looking at how CIS Hospital can help its clients on how to pay back the hospital fees. And today we are proud to say that we have the biggest number. We have over 40,000 people registered and who subscribe annually with our community health insurance scheme.
We have also supported the idea of community-based health financing. This is mainly to allow our people to pull together when it comes to issues of health and also getting timely treatment.
Evidence has shown that the problem with this system is it discourages the poor from using organized public health services and is associated with delays in accessing care and with increased use in home remedies and other informal sources of care, which is counterproductive in reducing mortality and morbidity rates.
We started with a membership of 32 and one group, which is the pioneer group, community group, Sijira, Good Hope, and currently we are over 1,800 members in the group, and we have over 9 groups, including schools and community groups.
We have sensitized over 30 groups so far in the community. These include the cooperative circles in the community, the religious groups, the Mothers Union groups in different sectors of the community. We have so far enrolled over 1,000 members.
The community health insurance has been an alternative to the out-of-pocket catastrophic health expenditure, and it encourages social inclusiveness as well as reducing health-related expenditure shocks to the institutions and individuals in the community.
Kana bindi yaho murundi gumwe natungaho omuntu yamanyisa ngu nshemere kuba ninza aha mushomo ibanda aha compassion kuna ikiri ibanda banshomesa aha bintu bikwatine na insurance then nija na informinga group members banje abunabire nyine abo twabire turi hamwe aha cyaro nitukwatanisa twine kigombe kitu nicyo kubika akasimbi
nkora muzugwanje ngura konyo ngura kasabuni akanasazyaho sevinga urukombe rwanje nobunta rwine konkamanya ntato bunyi namagara ninza kutekwa kuzowana ninkora muzi nintere kigombeshye ninga nifuna ezo kusevingirwa rokorahika mbenkine katambu nimpura ninkera rikera muno
abo kubito turi abantu abo mu cyaro so twatukira question so bundi ushanga ntuza kuronda umwana cyashasha tubanza twaza kuronda abajumburizi ngo turonda abajumburizi konka hatiya umwana yashasha tubanza twamutwara ahirware
ana abana banje ntibakundira kimwe no bakuterwa mutu nuhura mama twarahirware miseni mweno hura bokusangu ninkeshinti chamani kirungi mweno bashesi mbaba ngo barware ibanda miseni
tukabana turakingamu no kushomesibwa konka tukatunga imishomo batushomesa hati abana ati bari kurwara nko kubabire bari kurwara tukaba abwo kuba mwe bakabashanga batine butimba bakabutereza abana batunga butimba ba umushija twagucendeza.
Many people sometimes say we must deal with the spiritual aspect, but we say no, for us we deal with the whole human being. In the Gospel of John chapter 10 verse 10b, Jesus said that he came that people may get life and get it in abundance or abundantly. So we cannot just deal with the spiritual aspect, but we also deal with the physical aspect. That's where the church comes in with the issue of having health facilities spread everywhere. And for us in Chinchizi, we have established health facilities in remote areas. And at the moment we have like 17, including Bwindi Community Hospital.
kandi turi mu kibina cy'abataka kwetambira ekirarebera amagara g'abantu kandi twagize hano yatugwere turahaka sente kake kari kuruga mu mikono ya abaratureberera kandi twayiza hirwarira aha turatunga imibazi kurungi yaba tushashire munonga batuteha bitanda
abana bagwara bariza higwarira aha batuhereze bizuma nangwa na ngwara ganzaho bampereze bizuma binyamba.
Veran Junior School is a member of West Ankole Diocese Health Cooperative, which started the year 2013. This cooperative, health cooperative, is cheaper, relatively cheaper compared to what we usually to spend before it was introduced.
In our schools, we have improved academic performance because whoever falls sick is able to access services at any time. Remember, we have outreaches. We have outreaches in those schools So whoever is not attended at the school level is able to be referred to the facility.
Insurance gives one peace of mind during when they are admitted on the ward, because they know somebody else is going to pay the bill. The insurance is going to pay the hospital bills. Even when they are at home, they are not worried of when they are getting sick and when they are going to pay.
The health insurance, the way we had perceived it, has had a lot of benefits. It has helped us to plan, because when we are starting the year, we know that we have, for example, 27,000 committed users of our service this year. So we start off by planning the purchase of medicine using that.
The hospital gets cash beforehand, and this cash helps in budget. It helps us to budget and to improve the quality of services of the hospital. We are able to work on our equipment and buy more equipment. We are able to hire quality staff and actually retain them at site.
It has created a good relationship between the facility and the communities. The communities actually own the facilities, because when they submit their premium, they become owners of the facility, meaning they advise and we get client feedback.
The kind of health-seeking behavior has improved. People come early to the hospital to get treatment. We no longer see people who are carried in stretchers coming to the hospital.
The childhood mortality from our studies is reduced by 36%. Seeing the neonatal mortality similarly being reduced, stillborn rates being similarly reduced. Women are coming in earlier in their pregnancy.
Because of our location, some places distant feel a challenge of traveling here. So now we are activating facility satellite clinics, such that if someone is a subscribed member of our insurance from Kanungu can get the service from Nyakatare Health Center, so that now we become a referral center for all insurance members.
One other intervention, the community health insurance working with the Chisizi Hospital, what was initiated was to establish a mother's waiting home. And this is a hostel for pregnant mothers.
The hostel has become a model for this country. Many people have come to see how we've managed to do the hostel and how we manage to run a service where we do not only have a building, but well attended to. Mothers are attended to by a health worker. There are education services that we give to these mothers to reduce on malnutrition problem. All mothers here, they are going to have babies in the next 1 month. So we use that time to have cooking sessions with them. We use locally available foods to teach them how to prepare a balanced diet.
Though it has had many successes, it has not been without its challenges.
The volume of care has increased, and now our catchment has gone beyond the original 3 sub-counties.
And then, of course, also the community is still poor. Raising that 5,000 premium that we request per quarter, some people cannot afford that, especially if you have a large family and we are requiring you to insure the full family. That sometimes is too much for them.
UPMB member health facilities initiates CHI schemes and have a captive community of patients who use their services. This way, UPMB hopes to achieve its goal of increasing access to affordable quality health services in communities through establishing functional community health insurance schemes in at least 20% of the member health facilities.